From breaking news to every big story that affects Newfoundland and Labrador, VOCM is there. You want access to the decision makers. You want to hear from the biggest newsmakers. You want to know what your neighbors are thinking. VOCM is there. VOCM, the province's most trusted news voice since 1936. And here today to cover every major event and story that will shape our future. Newfoundland and Labrador's news leader. This is VOCM.
Now back to Linda Swain on Target St. John's on VOCM.
And we're back on Target St. John's. Dr. Janine Hubbard is our in-studio guest, and we've been talking about some things that happen in the fall. One of them is the waning light, but another one is flu season. And it's the time of year exactly when people are encouraged and expected to get their jab. And we heard the ad just then from Health Minister Dr. John Haggie during the break. And to some people, it's not a pleasant thing to go through, but, whatever, I'll go get my flu shot. For others, it's like, no way, right. No way. You can see great big grown-up adults trembling at the very thought of it. So is there a real anxiety when it comes to getting a needle?
Oh, needle phobia. And I mean, it is a legitimate phobia. Listen, nobody likes getting a needle. And that's one of the first things we need to establish right off the beginning. And again, I don't believe in lying to anybody about it. Yeah, it's going to hurt for a second. It's going to be a very painful inconvenience, although particularly in the case of the flu, I guarantee you it's going to be much less painful than a week or two in bed, and if not more severe consequences. There are lots of ways to work with coping with it. Yes. And for people for whom it's a bit of an inconvenience, you might feel a little achy for the remainder of the day. I once worked at a hospital. I thought this was brilliant. They gave us a little 2-pack of painkillers, and they gave us a little Halloween-sized candy bar. And that was our little incentive for going and getting our flu shot. And I thought that was perfect. The timing worked well. But no, in all seriousness, for a lot of people, this is something where they want to get their flu shot, and they are just so fearful of it that it really holds them back.
Do some people not get the flu shot for that very reason?
Oh, absolutely. Or there are people who agonize over it. They, as soon as kind of the ads start to come in, they start dreading it. Depending on where you work, for example, if you work in healthcare, there's a lot of peer pressure for very good reason. And again, full disclosure, I've had a flu shot for probably 30 plus years every year. And I know that that's a choice that people make, and I know that that's not for everybody, and that's not a topic for today. That's a whole other issue. But there is often a lot of pressure, and it's one of these things that as adults, we're often ashamed to admit it. It's funny. It's still one of those, whether people brush it off and go, get over it, you'll be fine. But people aren't often willing to sort of say, no, I'm holding off on this because I am deathly terrified of needles.
Do you see it often?
Oh, my goodness. I do so much work around needle fears. In my case, I do it with kids, but it very often stems from you have parents who have needle fears themselves, and without even realizing it, have transmitted a lot of those fears towards their kids.
When does it become a problem? How do you know that just the thought of getting the needle is, I'm worried about that, to I am deathly afraid?
Yep. Well, and again, listen, we want to make this as pleasant and quick and efficient an experience for everybody. So the good news is, listen, I'm going to give you some tips today that you can use, even if you're just somebody who's like, I don't want to do it, but I'll suck it up and go and do it. We can give you some tips to make it a little bit easier. As with anything in terms of fears, we look at to what degree is it interfering with your life? Is your fear disrupting your sleep? For some people, it's just the night before they know they're going to have to do it, and you can work with that. But for some, like I say, it's that whole period building up. Is it interfering with your focus and your concentration? I have some kids where they know they are getting their needle in a certain grade, and literally the summer before going into that grade, that fear starts to ramp up because they know that needle's coming.
That sounds very familiar to me, I can guarantee you.
And again, there are so many ways that we can work on treating this. First thing I can suggest to people is assess, whether it's yourself or your child, assess your coping style. And it's funny for coping around medical procedures, most people tend to fall into kind of one of two camps. It's either I'm going to close my eyes and stick my arm out and just tell me when it's done. That's kind of the avoidant coping, and that's a great style. Nothing wrong with that. And then there is no, I want to know every single step that's involved. I want to know ahead of time. I want to practice. I want to have an idea of exactly what you're doing, and don't move on to step number 2 until you've told me what's coming next. And I want to watch, and that's fine too. But it's figuring out which style works for you, which style works for your child, and then coming up with the appropriate coping strategies for either of kind of those extremes.
I've always found, and I've got to say, because flu shots, I don't like getting jabbed, but that's no odds.
Yep.
I go, jab me, let's get this over with, I'm gone. But for my son, for instance, it causes him a great deal of stress. And he tenses up and all that stuff, and that causes me stress, of course, as a mother. But I find the staff are brilliant. They do everything. They've seen it all. They've done it all. And they're usually absolutely brilliant.
I'm really glad to hear, because that piece can make a enormous difference. In terms of how you're handling it, how you're approaching it, the language that staff use, and that you as parents use or you yourself use as part of the self-talk, is really important. You don't want to say things like, it won't hurt. You want to say, it's going to sting for a second. You're going to want to talk to them about you're being really brave. And acknowledging the effort that they're going through. But the whole, it'll be okay, you'll be fine, that doesn't help anybody, and all that does is ramp up your anxiety big time.
Why is that?
Because if you're there and you're feeling really anxious.
Lied to? Is that how?
Yes, I'm being lied to, and if you're lying to me about this, what else are you lying to me about? And okay, you said it's not going to hurt, and now it did. Or you said it's just going to, so it does. It escalates that whole fear spiral for you, for sure.
I got mine done just last week with Carrie Hodder and Ben Murphy, and I have to say it's the first time I've ever had it happen to me. I felt her pinch my arm, to get the flesh, and then she let go of my arm, and I said, okay, when are we doing this? She says, it's done. I literally didn't feel it. And so I can honestly say it didn't hurt at all.
No, there you go. And again, you were lucky, but you were obviously one of the avoidant copers, I'm going to look away and just tell me when it's done.
That's exactly right.
Which, like I say, can work really well for some people. And then others need the practice and they need the step-by-step. So the good news is there are a whole variety of things that we can do to help with this, both kind of beforehand and then during. So beforehand, one of the things that you can consider is, are you someone who might benefit from some of the topical anesthetic cream? EMLA is a common name that's used. I think there's a couple of them out there. And what it does is it just numbs the very top surface layer of the skin. It feels a little strange. So again, especially if you've got somebody who's kind of anxious, I highly recommend if you can get some ahead of time, put it on, maybe put it on your hand, put it on somewhere so that you can feel kind of what that numbing sensation is like. The drawback and why it doesn't work for everybody is you need to have put it on at least a half hour before the application, and you need to know where it needs to go on. But so for some people, that having an extra half hour to have to sit and wait and anticipate is so much worse than the just go in, get it done, get out. So again, it's kind of a little bit of trial and error and knowing yourself, knowing your child, what would provide you with more comfort. The time to wait and build up, but know that you're not really going to feel very much, or just get in, get it done.
Do kids respond to their own parents' anxieties? Like if you've got a child in your lap and you're hanging on to them for dear life and you're holding them tight and you're like, don't worry about this. Are the kids picking up on that?
Of course. Remember, I was mentioning before, they even pick it up subconsciously in terms of even how you approach it's time to get a flu shot. Just your choice of language, your tone of voice, even just discussing the topic, cues them from a very young age in terms of is this something I need to be worried about? Is this something I should be stressed about? It's no big deal. Anxious parents actually in the actual treatment room make things 10 times worse, 100 times worse, because children look to their parents for cues as to how should I behave right now. And if you've got somebody who's starting to cry and is upset and saying, oh, my poor baby, and that just sends them the message that this is something really bad. This is something really significant. As opposed to the, you know what? We're going to be here 5 minutes. It's going to sting for a second. And then we're going to go and do something fun. Real positive message, whether or not that's what you truly believe in your mind, whether or not that's what you're really feeling. And if you yourself have a really significant fear of the needles, it's sometimes better to have someone else go in with your child. You just step out into the hallway and either leave it with the healthcare professional or have another friend or family member go in with your child, because sometimes the parental presence can make things worse, unfortunately.
And I do hear that sometimes from healthcare professionals.
And there's no shame in that. That's helping out your kid in the best way that you can. And that's looking out for your child's best interests.
Indeed. Dr. Janine Hubbard, thank you very much. We'll be back right after this.
Now back to Linda Swain on Target St. John's on VOCM.
And we're back. And